We're ready for you.
So one of the things that you mentioned is that you started your drills in the ED, and it created a little bit of a dust up because the rest of the hospital didn't know you were doing it, and that was a lesson learned. How did you? I laud you for your efforts to develop the program in the ED and really grow it to your hospital. I guess my question is, how did you convince the initial response that you got from some of the inpatient units was like, well, we don't really want to do this because it's going to interrupt our operations. And that's true, right? It does. And you have to, especially for hospitals that are running nearly at capacity, any time where you're like, well, we need to dedicate these other resources to these simulated patients, it's like the same idea as doing a mock code and calling on real resources when there are other real patients to take care of. How did you convince the other units and your administration, I guess, that this is really pressing and needs to be made a priority amongst all the other competing priorities that hospitals have?
Well, I was very fortunate. So Mike Anderson was the CEO of our hospital at that point, and so he's a big person in disaster preparedness at that point. He actually was on the National Commission and appointed by George Bush. In addition, our CNO was a former Army nurse. So we had some administrative duos that were very powerful at getting this down. In addition, we're certified by JCO. JCO now has, they ask you to drill at least once or twice a year. They're asking you to include pediatrics. So there's some of that push that has actually been really helpful to come down also. So there's some, stick approaches that are there, but there's, it's more like, we really need to think about doing this. And we usually do it, we do a lot of our drills during the summer, and it actually really helps to, our volume tends to be a little lower during the summer other than traumas. And so that's been helpful, but, some of our drills are now coming in October. We're doing some in the winter. And so we're doing it at various times. Once you get the culture going, it actually really helps. So, we got the ED to do it, and then, it was pretty easy to get the ICU to do it. Then our surgeons got on board because they thought that this was a really good idea. And then they got their surgical floor on board. So it sort of got going just because people saw that happening, and it sort of got everybody enrolled. The NICU is probably our biggest challenge at this point because it's really hard to drill NICU babies. Those are really hard to drill. They're pretty fragile, but our NICUs across the state have been very engaged as far as faculty in figuring out the answer to this, because all you have to do is talk to a few people that went through Katrina with their NICU babies, and that's still very much alive in the NICU community.
Hi, Doctor. I'm Julie Schultz. I'm the Executive Director of the Oregon chapter of the AAP. Thank you for your talk. I'm wondering, when you have done the drills and other types of planning and preparation, this is kind of a broad question, but how much have you been involved with non-hospital-based pediatric providers with integrating them into any of this sort of disaster planning?
Well, that's a good question, because there was an inject in our NICU drill, because one of the things that we felt like it was important was to have the AAP involved. And so I'm the state chapter disaster contact for the state of Ohio. So Melissa and I work pretty closely together. And so we did an inject in that we actually asked all the hospitals to create communication, because, if you have, for the NICU patients, if you think about it, these are, they're sick babies that have been there. Some of them have been there for many months. And so the parents aren't always at the bedside, as opposed to the acute patient that, needed to be in there for antibiotics for a few days, and they're actually going to go home. So, how do you communicate to the families that we're evacuating our NICU, and where's that patient going to go? These parents and guardians at this point are already, their child's already very vulnerable to them because of all the situations and all the expectations that haven't necessarily been met. And so this is a situation where you want to make sure that you have good communication going on. So we actually asked all the hospitals in our NICU drill to create messaging for their parents. You know, how are you going to message these parents? How are you going to contact them? And so we actually had all the hospitals do that so that they all got practice at it. But we also said, you know, how do you get communication out? So we use the AAP for this at the Ohio level. They actually have a mass communication that goes out to all the pediatricians in all of Ohio. And so it was done during our drill, is that there's a drill going on, you know, we're going to be evacuating patients to these communities. And as pediatricians, you can support these families, or you support your hospital. Because if you think about it, sometimes you've got whole families that would pick up and probably go to that community because their child was going to be in a new NICU for a while. So how do you support those families and so on? So we tried to engage our pediatricians that way. And that's about the furthest we've been able to get. It's engaging pediatricians in the general practice in Ohio, other than Southern Ohio, which floods a lot, and we had some tornadoes and some ice storms. There's, disaster planning in the Midwest, we do have the Great Fault coming through Ohio, though. We can get a big earthquake. But short of that, we don't get hurricanes. We get some tornadoes. We just had a bunch of tornadoes in Dayton. So, I mean, these things do happen, but they're sort of isolated kinds of things. So the Midwest doesn't get the same kind of disaster stuff that we hear with wildfires and things like you guys experience. Yes, we do get river fires, although it's been 50 years since the Cuyahoga burned. So, well, thanks, everyone. Appreciate it.